Yo, yo, yo. Hey guys, welcome back to another amazing edition of the Best Practices Show podcast. My goal here is to find the greatest thinkers in all of dentistry to share some information to help you improve your practice and your life. And we are going to do just that with two rising stars in dentistry, Dr. Christopher Mazzola and Dr. Charlie Ward. And they share how they've re-engineered their entire new patient process and their thinking to find out what really matters to patients. It's an awesome episode. So please listen up. I hope you guys enjoy it, and we'll see you soon. Hey guys, welcome back to the Best Practices Show podcast. You know the jam here. I get to talk to the coolest people, best educators, best leaders in dentistry, and we share information to help you improve your practice and your life. And selfishly, today's a fantastic one because I have two upcoming rock stars in the world of dentistry who I really enjoy listening to. So selfishly, I'm going to learn a ton. Dr. Christopher Mazzola and Dr. Charlie Ward. And yes, they are fantastic. Hold tight. You'll hear more about them in just a second. And today we're going to be talking about decoding that whole new patient journey, how it evolves as a practitioner, and helping patients own what they come in with and how to think better. So, gentlemen, thank you for being here. I really appreciate you guys.
Yeah, thanks for having us.
All right, so I got to start here because we have a lot of young listeners. We even have pre-dental students now. So I know who you guys are. You guys have been on the podcast before, but I like to start with a little bio on who each of you are before we get into the subject. So who wants to go first? I'll pick. Charlie, you go first.
I'll take it. So Charlie Ward, practice in Baltimore, small group practice. My wife is our periodontist. I have a partner, Devin Conklin. We've been together since 2012. We bought practice together and another practice since then. And through that process, I've been involved with the Pankey Institute, and now I'm visiting faculty there, teach a few courses with other faculty and with Chris. So out there lecturing locally and nationally, trying to, as we say, move the needle and help people do better all around.
Love it. Chris, tell us about you.
All right, Chris Mazzola. I am in Traverse City, Michigan. We have a large group practice. We're 4 dentists and 7 hygienists almost daily. My journey began in Traverse City in 2014 when my wife and I moved back. This is where she's from. And have been growing with the Pankey Institute, some Spear, some Coyce, my buddy here, Charlie. Yeah, we were fortunate. We were asked to be visiting faculty at the Pankey Institute, which was an amazing achievement. It was and an honor. And, we get to do a little lecturing nationally, and we get to come do some study clubs with some people that ask us to, and we get to have a lot of fun with this. We love talking about it and trying to help people navigate some of the questions that we've had prior. And also, when dentistry can be a lonely spot when you're by yourself as a practitioner. So just trying to open the door that there's people out there that do want to help get through some of these roadblocks.
I love it. Love it, love it, love it. So today we're going to be talking about the new patient process, the evolution. Let's start big, the why. So if I'm a young dentist listening to this, why is this an important conversation?
Sure. I mean, this is where you are, you're differentiating yourself, you're differentiating your practice, and you're really, opening up the door for the patient to understand that it's about them and wherever they are at that point in their life. And that's both from a personal standpoint and from a health standpoint.
Yeah, I would add, Kirk, I think you mentioned the evolution of it. Like it does change over time as you learn and incorporate more um, knowledge and techniques into your practice and into kind of your daily toolbox of things. But establishing that rapport, I found as a younger dentist, you got to work harder to do that for patients, especially patients that are older. I remember those days going in. I wore a shirt and tie pretty much every day because you have to look like you're supposed to be there. And I didn't have any gray hair then, so that's a different experience for a dentist in their late 20s than it is for a dentist in their 40s. Um, to start to establish trust based on appearance. But then going farther and like Chris said, differentiating yourself, like how are you bringing a patient into the practice? What are the conversations you're having? What is that system to hopefully do something that other dentists aren't doing? Because that's what's going to make a difference in the people that you want, the patients that you want coming to your practice.
Okay, I have a crazy question. I'm going to pretend to be a brand new team member at each of your practices. Help me understand as a team member, because I would imagine a lot of dentists are like, I totally agree, but like, how do I get everybody on the same page of this? How do you describe to me as a new team member why this is so important to our practice? What's the first thing that comes to mind?
I would say for me, it's a stepping stone off of what our core values are. And you want people to understand, like for us, we're growth mindset, right? We're professional, right? We try to be as health centric as possible. And, in those ways, when you're involving and evolving patients with you, they need to feel that it's more than just box checking. So, I don't really do the same exam ever. And that wasn't always like that for me. I used to want to check all the boxes when it came from, all right, ortho classification, right? Like really dive into every single little thing, how far they can move right, how far they can move left, what's maximum opening, like all of these check boxes that it's not really about what the patient is presenting to us with. I mean, we have to make sure that they feel understood. And that all boils down to the initial conversation that we have. And that conversation for us happens in a non-clinical setting. It's usually in our consultation room where we can just sit down for a little while and get to know each other.
Love it. Charlie, give me your thoughts on that.
Yeah, and I would describe it for us as mission and vision, like as a group. So my partner and my wife and I, like what's the vision of the practice? How do we want patients to experience our office? And everything we do, the decisions that we make need to be consistent with that vision. So the way a patient comes into our practice and experiences us really sets up our relationship going forward. So it's important for new team members to experience that as a patient, right? So we kind of get over the honeymoon period of them being there. Then I need to do my new patient experience or new patient exam on that team member so they understand what our patients are going to experience. And that to me is baseline on how we keep that going. So if our team members can experience it, then it's easier for them to, I don't want to use the word explain, but I will explain to our patients like why this process is important, right? And that's what differentiates us. Like Chris was talking about a preclinical interview. I don't know how many times I've sat down with a patient, new patient comes in, we have a conversation before we go to the dental chair. And whether that's 5 minutes or 25 minutes, whatever it takes, at the end of that, they'll often comment, no one's ever sat down and talked to me before. Yeah. I haven't even done anything yet. Like all we did was have a conversation, but doing it in a non-intimidating way immediately differentiates you.
Yeah.
So,
piggybacking off that, simply stated core purpose, right? Like ours is, are you living it? Inspiring and transforming. it. I period T period. That's what we want to do. Are you inspiring and transforming health in your community, health with your patients, health in your family? So that's the first thing that comes to mind, circling back through that, and the staff needs to feel that, and your patients are going to feel that. And once your patients feel that, then that rapport starts to build, and it starts to build even with when the first phone call comes in, are they answering the phone with a smile? Man, that's so critical.
Mm-hmm.
I had a new patient yesterday that was telling me he called our office. He was searching for a hygienist. Okay. He was searching for a hygienist that left his previous practice, and he was told that they were at our practice. And they were not. And so one of my front desk lovely ladies, Caitlin, she started calling other offices in town trying to track down the hygienist for him.
Wow.
Okay. Called the patient back, said, I found Jan. Jan is at X office. And he said, I can't believe you did that for me. And she goes, why? She goes, no dental office would do that, try to get a patient to a different practice. And it's like, we just want you to be happy and comfortable with where you're being treated. And so then that spiraled into, he came to us because there was so much trust built already in the fact that someone would go above and beyond like that. He sits down yesterday for our preclinical conversation, and I start talking about things that he had written in his forms, and he stops me and he goes, you read my forms? I said, I wouldn't have had you fill them out if I wasn't going to read them. So again, like tying back into things you ask your patients to do, it helps to build. You're just continuing to layer these bricks down on building this foundation on why this patient wants to come to see you.
That's so powerful. I would say nobody does that.
Right.
And what's more important is the heart behind the engine. Now, I think it's important to note, like, Chris, how many team members do you have?
30.
And how many patients are you talking about that you have?
4,500.
4,500. There's enough to go around. And you guys are recently out of network, so in the state of Michigan. So I love this message. And Charlie, chime in on that.
Yeah, it's amazing how little it takes in caring for another human being for it to make a huge difference, right? I mean, it's not difficult for her to make a couple phone calls. Like, Chris is not in a huge town, right? There aren't a ton of dentists there. So it wasn't a big ask. And then the patient didn't even ask. Those little things, like, patient tells you that they're going to have surgery or something, like, hey, make a note, let's send her flowers next week when she has this surgery, right? We had a patient that had oral cancer a year ago. And we hadn't seen her. So I called her and she's like, oh my God, I can't believe that you called me. Like, I'm doing great. Everything's wonderful. Like, she's in tears on the phone because we just reached out to see how she was doing. We were concerned about her. It doesn't take much to differentiate yourself, and it just makes the biggest difference if we can take those little things just to be recognized. I mean, like a handwritten note after a new patient comes into our office, hey, thanks for coming in, and mention something personal, right? Like, hey, you told me about your dog, you got a new puppy, I hope everything's going well. Look forward to seeing you again. Like, it takes 30 seconds of my time. I hand it to admin, they send it out. Right? Those little things go a long way because no one's providing that service, right? Other dental offices probably aren't doing it. Their medical professionals definitely aren't doing it because they can't get more than 3 minutes with them FaceTime. Right. So, we're the ones picking that up and trying to care for people as human beings. I mean, that's really all it is. That's the way that I see it. Like, let's meet them where they are. Let's have those conversations and try to do the best we can to treat them like we would want to be treated by any friend or colleague,
Yeah. Well, let's go into this and go back to some of these concepts, go a little bit deeper. Walk us through the process. We talked about the new patient intake forms, the purpose of value, patient health objectives. Like, how do you help me understand how the two of you see this process now?
Yeah, I think now it has to start on the phone, like Chris said. We have to have a well trained admin team that understands that core purpose or that mission and vision. because they're the first point of contact. It's not me or Chris. If a patient has a bad experience on the phone and they happen to still come to our office, like it's already set a tone that I got to work twice as hard to correct. But if they have a great experience on the phone, it makes our job 4 times easier. They've already had that great experience. So making sure that, your team members are answering the phone, asking the right questions. One thing that we started doing, which we got a lot of positive feedback from the patients on, was at the end of the conversation, they would ask, is there anything that we need to know that would help us work better together when you come in for your first appointment? And you get 3 seconds of silence because they've never been asked that question before. And someone would be like, well, I don't really like the sounds. Can I bring my headphones? Yeah, absolutely. Please do that. But it's already like, hey, we're looking out for that person. So for us, it starts on the phone. And then from there, preclinical interview.
Yeah. Chris, how about you on that component?
I mean, I can't give any more value to the person who's picking the phone up. I mean, you're 10 seconds of that first interaction, that phone call is where a lot of decision is made in the patient's mind. And so I forget what company used to do it, but they used to have, it was an answering company in their cubicles that have a mirror. So everyone would, when they picked up the phone, they'd smile into the mirror. So they knew that they were giving off the energy of happiness, right? I mean, that is one of my ultimate pet peeves is when I call one of my medical offices and it sounds like the person on the other end is dying.
Yeah.
Like, is this place really that bad? And that's where I'm seeking my medical care from. That to me is a serious problem. And, one of the things that I will tell you we do in our practice is all of our phone calls are recorded for training purpose, right? So through Weave, which is a company that we use, they're all recorded. So we can help to grow, right? Because we have a growth mindset is one of our core values. So sometimes we go through the phone calls with our staff members and we just listen and we say, all right, how did this go? Oh, went excellent, right? Or what would we change? How do we make our questions more open-ended, get more out of the patient so they start to open up more and more early? And I will tell you, it is an ever-evolving thing because we have 4 team members up front and they are 4 unique individuals. And the way that something comes out of one of their mouths doesn't come out naturally out of the other one's mouth. So you can't, for us, in my big practice, have a script. It's concept-based on what we're trying to do. And, I think one of the most basic questions you can ask someone is just tell me about how you feel with your oral health. Simple, right? And say, well, I've been going consistently, since I was 20 years old. I'm 31 now, every 6 months with Dr. James. Well, tell me about Dr. James's practice. Oh, it's a small practice. I really liked him. He's got a great hygienist, very gentle. And you start to pull this relationship. And then one thing that you didn't even realize you found out is they value long-term care with one person. They just told you they had been with someone for 10 years, right? So we're trying to build long-lasting relationships. There you go. You're starting to see that they value that. And so that's something you can tie back into. Like my practice has been open for 70 years. So I tie back into that. If we have a note that they have been with a provider for a long time, we've got people in this community that have never seen anyone outside of my wife's family. It's a 4th generation practice, and we take those relationships very seriously. And a lot of people have stayed with us through great grandpa to 2 uncles to Christina and McCare, who are the 2 family lineage in part of our practice. So you're always trying to just get a little bit of information that you can help tighten the relationship in something that is very uncomfortable for a lot of people.
Mm-hmm.
I don't know if you know this, Kirk, but dentistry is not that fun.
Well, we could debate that.
Well, fun for us to do, but not fun to be receiving.
Right. Oh, yeah. Oh, to be receiving. Yeah. A lot of people have said that. I don't know how many people have said this on the podcast, but they're like, it just sounds different when you're in the chair. The whole, everything sounds different. It feels different. And I think you guys would echo that sentiment. So
my wife's my dentist. I don't want to be in the chair.
That's right.
Yeah, I would agree. So, and Now, one of the challenges, you guys have evolved how you do this, and you said it's not scripted, it's concept based. And that's like, is that one of your favorites? Like when you were talking about this, like, I want to know about their journey with their oral health. That's, if you get anything, capture a little bit of that. Would that be the same for both of you?
Yeah, we have, 3 or 4 things, and that when we review our schedule and we know a new patient's going to be on there, I want to make sure I have this information going in to that preclinical interview, right? I want to know when their last visit was, preferably who they were seeing, if I can do that. I want to know who referred them or how they found out about our practice, because most of our patients are referred by another patient. So I want to make contact with that person. And if I know that the person that referred them, I know what their experience has been, right? So they're going to refer similar patients. If I have a difficult patient that had a good experience, right, and they're going to refer one of their friends, I might be getting another difficult patient. So I want to be prepared going into that. And then again, anything that would be helpful in that appointment to make them more comfortable, right? Like if they're leaving another office, well, tell me about what happened at the other office. Why are you not going there? Or why are you seeking other care? And if it, sometimes we assume something that is totally off base, right? It's like, oh, well, they obviously had a bad experience with the dentist. No, they didn't like the music that they played. Like it could be something you don't even think is an issue, but it's like, oh, well, she didn't let me hold the suction during the hygiene appointment. Like, I want to know that. If that's what drove them away from the office, I need to make sure that I can provide a different type of service for that patient and know that going in, right? That just allows us to take better care of them. So I want to know those things during that conversation on the phone, so that I'm prepared going into that first appointment with the patient.
Yeah. Chris.
I want to insert a little pearl there.
Yeah.
So this is something that I did the first 5 years of my career as a partner in this practice, which was years basically 6 through 10. And it is exceptionally humbling, and it takes some balls. But when you get the little note on your desk that says that Mary is transferring to a different practice, rather than saying, I don't know what Mary's thinking, call Mary and say, Mary, it's early in my career. I'm trying to grow and get better. If you wouldn't mind sharing with me on your reason for transferring. And I did that for 5 full years. And I tell you what, it just made me kind of get nauseous talking about it, because it is an awful phone call to make. But if you truly want to grow everybody in the practice, because it's going to give you insight, it's not always going to be the dentist. Right. It's going to be the way you handled billing with Delta Dental, how far off your pre-auths were, right? All of these things, right? The way that the hygienist used the Cavitron versus hand scale, how cold the office was, like all of these little insights can just help just turn and move the needle just a little bit, to where fortunately now I don't get nearly as many of those as I did before, in year 16. Yeah. So I don't know. I just wanted to put that in there.
I love that, Pearl. Okay, now I got to ask, because you opened the door. What's the most memorable call that you had? Like, you're like, oh gosh, like what's the first one that comes to mind? And we're all friends here, so it's okay to be vulnerable.
One that always stuck with me, because I had a really good relationship with the patient and we had done a bunch of dentistry, was that the chair was uncomfortable. She was going to find a different office that the chairs were more comfortable, and they were brand new ADEC chairs. So I'll never understand that, which to me, when you like really circle back, there was something she didn't want to tell me, it was something that happened that maybe she wasn't ready to tell me at that point, because it was still fresh in her mind and fresh in her heart. And it was some way that we disappointed her, because we had worked her through a TMD issue, and we had done some ortho and some restorative dentistry. And like, I can still see it in my head, that sitting on my desk, it's like just kind of blown away. So it was definitely, you got to take ownership where ownership is. And I would love to know what it was. Because
Charlie,
it wasn't the chair.
Yeah.
Charlie, what's
Great.
now? This is I got to know. Like, Charlie, have you ever gotten feedback? What's the most memorable feedback that you've ever gotten from a patient? You're like, okay, that was a learning moment for you. Anything?
Man, that's a great question. I just, I'll say this. I had a conversation with the patient, didn't leave the practice. The patient wanted to switch hygienist. And what I found in the conversation, because it was like, I'm going to have to call this person, right? Like she had an appointment. She came in, she wanted to see someone else. She came back. She was confused about who she was going to see. She left the office, and she's mid treatment in ortho for a complex case. And this was just for a hygiene visit. And so I called her and I was like, just, what happened? Can you walk me through it? Because I'm getting the story from hygiene and admin, which was very different than the story that she told me. So I would say in a lot of these cases when there's someone is upset about something, there's been some miscommunication, right? Someone had an expectation that wasn't met, and usually that's a result of failed communication. And I have no problem falling on a sword, like especially with I'm like, totally my fault. I'll take care of it. I'm sorry that you had this experience. I actually remember, Kirk, we had a hygienist that left. We had two hygienists leave within 2 weeks of each other. And the one we wanted to give, yeah, it's fun. The one we wanted to give more hours to, I had the conversation with her. She was working like 2.5 or 3 days, and I couldn't give her more hours. But we had another hygienist. I'm not going to take hours from someone else to give to you. That didn't seem fair. No one was, and I told her that. I was upfront. I'm like, in order to give you more, I'd have to take from someone else. Would we do that? So the one of the hygienists gave 2 weeks. On her last day, the one that I wanted to give hours to gave 2 weeks. And I was like, okay, well, she's leaving, like, and obviously they had spoken, and it wasn't about that part of it. So I did have a conversation with her, because I'm like, we're able to offer you these hours because this other person was leaving. It was just very frustrating, the process. And it was more about value. Like she didn't feel that she was being valued the way that she wanted to be valued. And the hardest part was that my wife, Melody, who's a periodontist, had really taken a lot of time and invested a lot of energy really training her. Like we'd block time out of the schedule for her to observe surgeries that she was doing, like specifically perio surgeries, not implants and so forth. But it's like if someone had scaling and then needed osteosurgery, we would bring this person in to observe so she could see what this looked like when it was flat. So there's a whole lot of time, and my wife took it very personally, very personally. She's like, I've spent all of this time training this person and they just left. So, it's all that, like Chris said, they can say it's about one thing, but in a lot of cases, like somebody's values were hurt there, whatever that is. But that one I remember. That one I remember. Yeah.
I totally agree. If you're a dentist listening, like number one, to humble yourself enough, because it will happen. Just be like, okay, I got to reach out to them. A lot of times they'll say this, I'm just so glad you called. I still don't like you. I actually said one thing about, I did this conference, like you're bringing back some post-traumatic stuff for me. I made a joke about like the next generation and their work ethic. And I actually don't even remember doing it. I was just making a joke. And this woman wrote me a big, long email. And she said, how dare you throw my generation in a bucket? There are some of us that are working hard and taking notes and blah, blah, blah. And I purposely gave you a 1 star, and I told the meeting to never have you back. And I'm like, I got to call her. I mean, I was in a full sweat. I was like, and she ripped me apart for like 5 minutes. And at the end, she's like, I'm just so glad you called. And I would really appreciate if you respected our generation. And I was like, amen. And then she hung up and I was like, but I haven't done a joke like that in a long time.
Yeah.
So, like, I think there's so much learning if you're open to it. People will tell you how to succeed. They'll tell you how to be a little bit softer, a little bit more humble. I love that tip. So I want to get back to the purpose, because I have like 92 questions I want to ask you in an hour. So I want to get into the office and how you connect with patients. But before we do, I want you guys, I'm going to take you on the journey I've been. 30 years of doing this. One of the challenges dentists have about learning a lot is the dogma. I'm sure you've heard about this. I learned how to do this, and now the dogma is everybody's got to come through the practice this way. How do you guys see that? How has that evolved, and how do you talk about that, and how that journey works in your practice? Do you know what I'm talking? You both know what I'm talking about.
Yeah, absolutely. I think, I started at Pankey in 2009. And I was working with two dentists who had been there, for 20 years before that. And I think that there was a period of time, and I'll speak to a time that I wasn't there, that it was very dogmatic about how you had to have a new patient experience, right? A new patient experience, 90 minutes, no questions asked, doctor only. That's how patients come into your practice. If you don't do it that way, you're a failure. There were very hard rules around that. And that to me is what I would describe as the dogma. And you're missing opportunities, and all of these negative things happen if you're not willing to follow that process. So what I found, and what we found, Devin and I, my partner, was as a young dentist, we need to build a practice, right? And being very dogmatic and strict restricts the flow of patients into your practice. So we had to have a conversation because, her parents were seeing patients and had been treating patients for 30 years at that point. And they could afford to be more selective about how patients came in. For us, we said, okay, what are appropriate avenues for patients to come into our practice? Like, what are we comfortable with? How can we feel like we're providing care in the way that we want? And that's really, and we alluded to it earlier, like patients come in to every practice as emergencies. People call your office, they aren't patients, they broke a tooth, they chipped a tooth, they have pain, whatever. That's still an opportunity for you as a dentist to see a patient that will become established in your practice, right? They can come in as an emergency. And if they have a great experience, they're not seeing a dentist, they want to continue care with you because you've done all those things, answered the phone well, treated them with respect, like gone above and beyond to do that, and hopefully taking care of their problem. Invite them back for a new patient exam. Say, hey, I think you have some other issues going on. I'd love a chance to work with you. If that would be okay, we'd love to have you back for a comprehensive exam. This is what that would look like. And ultimately, it's their choice. So you still end up in that lane where I'm treating patients comprehensively like I like to do. So emergency is the first one. I'm a parent, so now I'm seeing parents that are the same age as me because their kids go to school together, right? So they're in their 40s. Most of them are pretty healthy, but not all of them. And I'm seeing some of those kids. I love kids. I don't like to treat kids. But they're coming into the practice through hygiene. They're not seeing me first or my partner first. So there are kids up to essentially, we cut it off at 25. So anyone 25 or younger who's a new patient start to our practice can come in through hygiene. If for some reason I see a 20-year-old who's congenitally missing laterals or needs other dental work, then they can be filtered into something that's a more comprehensive exam, right? And then really the third way is that patient that calls who's over 25 may have specific dental needs that they're aware of, may not. They're coming in, we're doing a pre-clinical interview. I'm sitting down with that patient. We're talking about both their dental and health history, but also their goals and, what do we want to work toward here? So we feel, and I think I speak for Chris as well, the more open we are about how we can bring patients in and then provide them with the opportunity to choose what lane they want to go in. I remember a friend in a study club when I was young. He was a dentist who'd been practicing for 15 or 20 years. And, he's like, I live in a town that's a tourist town, so I get a lot of emergencies. I get a lot of people that are there for, 6 months out of the year. So that's where a lot of my new patients end up coming from. And they decide to stay with me because I give them that opportunity. Now he's like, they may have another dentist in their other town, but they're with me, and I just had to change my mindset around what that looks like for my own practice. So I just feel like I'm not really dogmatic about anything. And I feel like in a new patient flow, we have to be as flexible as possible if we want to grow our practices.
I love it. Chris, your thoughts on the dogma?
Oh man, I love dogma.
What? Wait, back up. What? You love it?
I love blowing it apart.
Okay. What does that mean?
It just gets me excited to learn something that it's like, oh man, I was doing dentistry this way for the last 7 years, and then I'm like, oh, there's an easier way that treats the same and gets you the same results, and people are happy, right? So I always look at dogma as being arrows in my quiver, right? Because there's so many different dogmas that I've learned over the years that some people it's the only way, whereas not the only way, right? I mean, geez, we can go Pankey, Spear, Coyce, Dawson, and then you can get in some of these other fun ones, like you got LVI and you got Nathedonics and you've got what's the other? There's one more. It's a 3-letter acronym. It's going to kill me. I can't think of the name of it. But anyway, right? All these ways can all treat patients. They can all treat people really well, but they're not going to all work for one person. And some of them are going to work better than others. And you have to be very well-rounded. And that's one of these things about blowing up dogma is like, I can treat one person a little bit differently based on now personality style, right? Like, do they have no ownership in the fact that they've destroyed their teeth? I can go from a slower perspective and put them in appliance therapy. So then they feel change occur. And then they ask me what needs to happen in a worn dentition case, right? Rather than just saying, you're worn, we need to fix, right? Like, and then let them come to me and we start to learn and build together this foundation of knowledge as to their condition. Okay. So that's one of the reasons why I like blowing up dogma, but I got to tell a quick story. So 2014, get to the Pankey Institute. I'm like, yeah, I love this stuff, right? I'm learning this comprehensive new patient exam, and it's a wonderful approach to getting information about your patients and building relationships, right? Because they have a strong behavioral component to the education. And then a mentor of mine, who I'm not going to say who it is, he is in my E2. And he's telling me that every single so E2 is Essentials 2, which is when you learn appliance therapy. Okay, back that up. That all of his new patients, his goal is to equilibrate them. I'm like, ooh, that sounds fun and fancy. I need to learn how to do this, right? And then the more I thought about it, the more it just dawned that that's not appropriate for every new patient, right? Because there's plenty of patients who live not in, for those who don't know, you equilibrate to get someone in centric relation. In centric relation, and they're just fine. I forget the statistic. Do you remember, Charlie, what percentage of the population is actually naturally in centric relation? Is it like 4, 5, 6, something like that?
It's small. I don't remember the number, but yeah.
And how many people do we have that are destroying themselves? Right. Not anybody. You know what I mean? It's like, so we talk about these dogmas, like that's why dentistry truly is a profession where you need to continue to push your learning. And because you're going to learn one dogma and then you're going to practice it, and then you're going to learn another dogma, and then that other dogma will blend with this new one, and then you start to formulate a treatment philosophy, which is really where I have blended all of these different things that I've learned over time, right? Like the Pankey Institute is amazing. It was built on some of the fathers of restorative dentistry. All the people in big dentistry now pretty much learn there. You've got your Spears, your Dawson, your Coyces, right? They all have backgrounds that come from that, and then they continue to evolve and learn. And so every time I go to any of these courses, it is changing, believe it or not, even the basic part of my new patient exam. So if I was going to talk about what I do now from in conversation and in my dental history form, it comes from John Coyce and their dental history form. I think it's fantastic. It breaks the person into 4 buckets. And I talk to the patients about these buckets. One is gum and bone, right? How healthy is that? One is individual teeth themselves, right? Abfraction, attrition, wear and tear, right? Active decay. Uh, and then you start looking at function as a group. So how the teeth are interacting with each other and how the muscles correspond with that. And then the last bucket for me is aesthetics. And that's the 4th bucket. And in the dental history, there's 4 questions on there that ask about the patient's perspective on aesthetics. And if they say that they're fine, I leave that bucket on the other side of the room. I don't ever go there. It's just not something that I'm willing to put my judgment into their mind and heart. I'm just not going to do that. But if if there's a yes, we go into a different mode where we start talking about how we can improve the smile. So yeah, that we do learn dogmas, and it's okay. But I just always challenge people that are stuck in the dogma to go learn more and see if they can pull themselves out of it.
Yeah. Charlie, can you speak about, do you see your process in the same way in 4 buckets or a little bit different, unique?
It's a little different, just because I haven't had the experience, of course, that Chris had, but the thought process is the same, right? Conceptually, we're looking at all of those things, and as someone who's, I do probably more cosmetic dentistry. I don't make judgments. Like, we ask questions, but I never want someone to feel like that question is a judgment on their aesthetics. So I do want to be clear about that part of it, because I think those questions can be difficult to ask. But the rest of it is very technical, and I think if we tie back to what we've talked about in sort of the first part of this, is we're building rapport so that when we go into these technical things, that we're sitting side by side, and it's not this hierarchy that we've created. Like, I'm the dentist, I know everything, I'm going to tell you what to do. And that's exactly what Chris is saying. We're having a conversation about what we observe and matching that to the goals that the patient has expressed. And I think you're seeing that more and more in medicine and dentistry and everything. This is a collaboration about how we go about this process. And that's really how I look at it. I won't even call it a template, but like, I'll take photographs and scans and collect data during that initial appointment. And then based on our conversation and that data, I put together only the relevant photos for the patient to see, right? If the patient's worried about something, we're going to have a photo so we can talk about it, right? If they're not, then I don't need to go back to that. I'm not taking the full AECD series on all of my new patients, unless there's a specific goal to improve aesthetics, right? And if there is, we're going to look at only what's necessary to do that. I don't need necessarily to take a healthy patient through a tour of every single tooth, right? I can show them an occlusal photo or a smile photo and say, this looks great. And there's, to me, the pearl is, don't make the whole treatment conversation about everything that's wrong, right? If someone's doing a great job keeping their teeth clean, let's start with all the things that are positive, right? What are all the positive things that you're doing? If your goal is to be as healthy as possible, well, you're doing a great job cleaning, you're consistent with your flossing, all of that looks wonderful. You expressed a concern about, a tooth on this side was discolored. Let's take a look at that together. And it to me transfers over into how we present that, literally the wording on the documents that I'll put for the patient. Like, we had someone before who would write like problem list was the first thing at the top. And I'm like, I don't want the first thing a patient sees to be all of their problems.
Right.
I can have concerns, right? That makes me empathetic. Like, here are the things that I'm concerned about, right? And then, what are the possibilities? Like, it doesn't have to be so strict and dogmatic about how we put together and the way we learn in dental school. Like, here's all the teeth that have cavities, here's all the teeth that need crowns, here are all of your problems, and here's a piece of paper on how we're going to fix it. Right? That's a very different experience than we talked about you getting healthy. Here's all the things that I see that are pointing towards you being healthy. Right? You're doing a great job with this, you're doing a great job with this. You wanted me to find ways to help you improve that. Here are the things that I see. What do you notice in this photograph? Well, this looks inflamed. This looks like an issue. What is this? Right? These are conversations that we can have. And again, these are skills and processes that we've learned over time. But those types of conversations are helpful for patients to take that ownership so that when they're ready to take the next step, we're both doing that together.
Yeah. Can I ask you about this? And I want to ask you, Chris, about you said before we hit the go button, I want to be the instrument. Explain that.
Yeah. So what I had expressed was, when we're working, let's say we are discussing a treatment plan with the patient. I see myself as the instrument by which they get better and they achieve their goals. I am not the hammer that forces them to do those things, right? They are the ones making the decision based on those goals that they want to achieve. If they want a better smile and they have spacing between their teeth, we're going to have a conversation about the best ways to correct that. We're going to look at those together. We're going to talk about pros and cons, and I'll make a recommendation. But ultimately, they have to accept the risk associated with any of those treatments. And then I'm the one that helps them achieve that goal, right? They've decided, hey, I think I like the veneer option, the way you described that. I think we can achieve that goal. I would agree. Now I'm the instrument by which you get to achieve that goal, right? That's the way that I see my relationship to the patient when we're going on a treatment journey, if you will.
I love it. Chris, how does that relate to how you do it?
Yeah, the parallel that I continue to see is like having the patient have ownership in their condition, right? And that's the other way of thinking about us being the instrument as providers. When you're having these conversations, I think one of the best things you can do is ask permission to share concern, because some people come in healthy in their mind. And then as you're kind of walking through there's a different tone in the exam. It starts to change a little bit. You're finding out that there's really more happening than maybe what the patient realizes. And, I'd say something like, Kirk, I know you expressed on the phone to Joy and when we were having our conversation in the other room that you feel like you're very healthy. Is it okay if I share some concerns with you? And then just that empathy, right? That you're just kind of going with them into this rather than saying, all right, you got periodontal disease, you need scaling and root planing, you're going to see the hygienist for 2 hours, then you're going to be monitored at 6 weeks and at 8 weeks to see how the periodontal charting changes, right? You're not, that's another pearl. I'm going to inject one in there. As a new dentist, I learned this from Paul Homily a long time ago, Paul Homily has a wonderful way of communicating with patients and really getting them to feel understood. Record your new patient exam. Put it in your assistant's pocket, an iPhone, and just so you can do it from an improvement standpoint. Because I guarantee you say words that patients have no idea what the heck they are. Right? Like, no one knows what an occlusion is. Dentists barely know. I'm still learning what an occlusion is, right? Like, these are the things, like, we use these words to sound smart and people don't know what it is, right? So that's my little pearl. Record and then grow. And you can do it with your assistant too to see where little misses were. Jumping back, the system that you develop, right? These interactions happen over time. It's nothing that in dentistry, we get a new toy like a Trios and we want to just like scan. Communication and building relationships, you don't learn it like that fast. It's not easy information to download on your phone. It's through really caring and trying, right? Like you have to want to build these relationships, and it's hard and it's challenging and it can be emotional for people. I shared with Charlie, I had just restored, we had a lady who had a benign tumor in her sinus that lost teeth 10 through 15. And we had been rebuilding and rebuilding and rebuilding. And she had surgeries and grafts and sinus lifts. And it's someone that I wasn't even a new patient to me, was a patient of the practice. And we just happened to find this problem. And she was hesitant, and then finally went through with the surgery. And when we put in the PMMA transitional screw retained hybrid, she lost it. Like tears, you've never seen tears flow like this in a lady. I mean, she looked in the mirror and this big, beautiful smile, she turned around and gave me the biggest hug and said, I cannot thank you enough for being so patient. Because I didn't force her to go into this treatment that she wasn't ready for. I was just there as the instrument listening to give her possibilities. And when she was ready, she went with it. She did what she had to do. You know, it's okay for it to not happen right away.
Yeah. I have so many questions. Okay, so this is one of my favorite things is nuances in philosophy or self-awareness. And let me explain. As you guys describe the why and the how behind it, I want to know a little bit more of the detail. Like even Bill Robbins and Jim Otten. It's amazing how different their processes are. Like Bill has to do it at the end of the day. He's like, I can't do it at the beginning. Jim is like, I can't do it at the end of the day. I have to do it at the beginning. It's like night and day. And by learning, what I learned about them is they learned about themselves. And when they give them space for this, what nuances are unique to each one of you and what you've learned about yourself and how you connect with patients?
It's funny you said it, because I think the biggest learning I've done, let's say over the last 5 years, is figuring out who I am and who I want to be. I don't know that I know, but I have a much clearer idea of that. And then I can lean into the part of me that I need to lean into to accomplish whatever that goal is, right? So I know what my shortcomings are, the areas I need to work on, where do I need more work, right? Where do I need to flex? And then what are my strengths, personally and professionally, and how can I leverage those to be more successful, right? I think that's to me, the biggest thing, because then I can start to build, my schedule around that. It takes a lot of energy for me to see a new patient, right? Because I feel I got to be on, right? There's a lot of emotional energy for me going into that appointment. I can't do that at 2:00. Well, I like that new patient appointment first thing in the morning so that I'm as fresh as possible. I like my bigger appointments first thing in the morning, right? I don't want to be prepping 6 units at noon. So again, knowing that about myself, my partner is the opposite. Like she could do it anytime. Like she's fine seeing a new patient wherever. That's where she gets energy from. But that doesn't work for me. So I think for me, figuring out who I am, doing that sort of self-work, allowed me to then go in confidently to these new patient experiences, because I know what I'm capable of, technically as a dentist, but I also, through that sort of behavioral learning, I can now identify what type of person I'm working with, right? Am I working with a driver, someone who wants that information, wants that technical piece to it, or is it someone whose kind of hand I need to hold? I had experience this week with a patient, and my assistant came to me. She's like, okay, she's ready. I go in there. She's like, oh, she asked about when her next bite wings will be, and we assumed that she was very comfortable. And I went in and I kind of, how you doing today? How's everything feeling? And immediately she starts crying. And we're doing 14 MO. That was our treatment plan for today. And I'm like, tell me what's going on. And she's like, I thought I could do this. I'm just so anxious, and I'm like, well, what can I do to make you more comfortable? And she's like, I don't know. And I was like, okay, let's stop. The first thing I need you to know is that this doesn't have to happen today. We do not have to do anything today. But what can I do to make you more comfortable? So the conversation now is around her anxiety in that process, right? Like, I'm not going to talk her into doing the restoration so that I save this hour of my appointment, right? I've got someone that emotionally has a need that we need to meet. So that was something that I probably, would have probably freaked me out if I was a new dentist, right? But again, knowing how to handle those types of things, learning about myself and how to identify those types of things in other patients. It's like, hey, the office isn't going to close because I don't do 14 ml today, right? But I can build rapport and help this patient have a better experience by sitting with her for 10 or 15 minutes and talking about what can we do next time that would help you be more comfortable. And it was nothing that we were doing. Like, this was all like her kind of build up to just having a procedure done that she hadn't had done in 15 years.
Yeah. Go back to, like, as you've learned about yourself in the morning, how much time do you allow? Now, I'll just tell you, like, I hate when somebody's talking to me and I'm really listening. So I know how much time do you allow yourself to connect in a new patient process per se?
Great question. It depends, for like a TMD patient or someone with complex needs, we have a 90-minute block in most of these cases. 45 minutes of that for a TMD patient might just be in the consult room getting a history.
Right.
Because a lot of those are dense. It might be 20 or 30 minutes for someone that has aesthetic needs, because we're going to talk about what brought you here, what are you hoping to achieve, what do you know coming in? Because the internet's a powerful tool, positive and negative. They've done research and they've seen some things. I had a patient come in and was like, I think I need zirconia crowns. And I was like, tell me more about that. So it really depends, Kirk. And I feel like in those first couple minutes, I can kind of determine how this is going to go, right? And is this going to be a slow process, or is this person ready to roll? But that's to me, as knowing enough about myself, that takes a lot of energy for me, right? I'm not the extrovert I may seem to be when Chris and I talk together, because it takes a lot of energy for me to do that.
Chris, nuances philosophically and self-awareness in this process.
Yeah, I agree with Charlie. The last 5 years has been more self growth than like hand skill growth. Spent a lot of reading and learning, and I've sent you stuff and I've sent Charlie stuff, and it's really trying to find an understanding of just who I want to be what for, right? It's a funny saying, but it's true. It's like, well, who do I want to be? What do I want to be? And who is it for, right? Who and what? And that in and of itself is an evolution. I can't speak enough to leadership books and just trying to find a way to grow humbly. It's, an understanding, the more you know, the more powerful it is and the more you can help. The behavioral component with dentistry is something that there's not an incredible amount of education out there for it. And it's, dentistry, I think it's 20% hand skills and 80% behavioral. And so much of it is just evolved learning for people. And some people naturally are great at it, and other people's, you have to fight it. And instead of fighting the current, you got to swim with it and just learn, like Charlie said, where your strengths are. There's things like strength finders and all these other things that can really help to dial you in to knowing how you can thrive in these conversations, because this is a lot of the success honestly, on the relationship is built here and built as communication happens through those first couple times in the practice. So I think learning personality styles is very important. The nuance that I have with my assistants is we're trying to figure that out as we're sitting there in that room. There's four main styles, and we're trying to, are they a driver? Are they an analytic? Are they introverted? Are they extroverted? That like what are we? How are we going to communicate the way that they want to be communicated to? That's the hardest part of our job, right? If you have a driver, they might want their problem list. They might be the one group, that 4% of the population, that I want to know my problems, I want to know how to fix them, and I want to be done.
Yep. How fast can we do that?
Right. If you tell the emotional expressive that they have a problem list, and then the tears, and then, oh my gosh, I'm going to die. My teeth are going to fall out of my head. I'm going to have dentures at 38 years old. No, Sally, that's not what I'm saying, right? So you have to be careful, and that helps, that understanding, that nuance of the personal behavioral development part of it really will strengthen your relationships with your patients and with the staff, with the patients as well. It's not just learning for myself, it's learning for the staff as well. You can't be speaking two different languages. It's like if I went to someone who didn't know, hey, do you see that driver over there? And they're like, what are you talking about? Right? Like, people in my office understand what a driver is because I'm one, first of all, right? And I have to flex every single office meeting because I don't have an office full of drivers, right? So that is speaking to them that the way that they want to be spoken to is exceptionally challenged, even just peer to peer, right? My wife's not a driver. I can't speak to her like a driver. Sometimes you do default to it when things are stressed. You always stress to the easiest way to do things. But yeah, I think if I were to give advice, if dentists are struggling building that relationship component, well, don't go to CE on learning how to do a really fancy class 4 composite. Like, why would you spend your money learning a skill that's not going to help to get people in your chair for the long term? That's a bias that I have, is like, we don't spend enough time on that in dentistry.
I remember John Droder talking about that, Chris. He's like, I went and learned all these, fancy technical ways to treat these patients. And he's like, I went into my lab one day and realized I had models upon models on my walls and no one would accept treatment because I had no idea how to talk to people. And we don't learn that in school. These are skills. These are skills. Some people are naturally gifted, right? Kirk, probably one of those people, who can just talk to people, right? Like, you can talk to people. But for a lot of us, you have to learn that just like you're learning technical dentistry, just like you're learning class 4 composite layering, just like you're learning veneer preparation. It's like, learn how to identify those personality types, learn how to do active listening. I mean, these are skills that they're not difficult to learn, but they require practice and time to implement and master. And the better you are at it, the better you're going to be about getting patients to come along that journey and achieve their own goals, right? Takes time.
Totally agree. Yeah. You guys, Pete Dawson died at 89. I went to his funeral and I feel like he's like following me around every day. Like, Pete, stop. And I hear these conversations. When I was 25, I went to see him for the first time and I hated it. I didn't want to go. I didn't want to see this old dentist talk. And I was, he was 65, 20. What is he going to teach me? And I loved it. And at the end, I actually got to meet him. He's like, yeah, I sat at this table. He wrote me, blah, blah, blah. At the end, I said, Pete, I really enjoyed this. I got to tell you, I go, any advice you give me? Like, give me one piece of advice before I get on a plane. He's like, I would say this. Don't ever tell yourself you have it figured out. Just constantly stay curious, because even at my age, I'm learning from these guys. And he goes, Kirk, you'll find your favorite people, they don't even have it figured out. They're always just curious. Yeah. I've never forgotten that. And Charlie, you and I are going to really get to know each other over beer someday, and you're going to be completely underwhelmed because I don't know anything. I think just by asking questions, you put yourself in another category. And that's what a lot of this is all about. It's just like staying curious. My daughter, who is 19, sent me a Ted Lasso clip yesterday. She's like, I want you to watch this. And I had seen it before. It's the one about be curious or judgmental. Try to be curious. Don't be judgmental. It's a good way to live. It's powerful. I'm like, honey, you don't know how brilliant this is. Do you know what I mean? So it's good stuff. Now, I do want to go back, Chris, just like energy and connecting. Do you do a lot of these connecting conversations in the morning? Are you an afternoon guy? Like, I got to know. Does it matter? Not really.
Doesn't really matter.
Okay.
Honestly, I would prefer to do my comprehensive dentistry right out the gate. I don't like having a new patient right after lunch if I can avoid it, because you're coming off this kind of lull. You probably had too many carbs, where you're just like got this energy suck in your belly, and you got to like overcome this somehow, and meeting this new person and bringing all of this excitement and joy into this room. And all you're thinking about is the sandwich you just ate. Like, that's probably the only place I would prefer not to have it, is immediately following lunch. But anywhere else in my day is okay. But, probably earlier in my career, I wanted to have it right away, just because this communication part of it, I had to use more.
Nope, we lost you there for a second, Chris. He's still, Mazzola still has AOL and dial-up.
He might.
Think
We'll wait for him to come back.
We'll get him to come back.
Yeah.
About how
He can't hear us.
I can hear you guys.
Oh, you broke up there for a second. We only got like fractions of it. You're good now. I was joking while you were off that you're still on AOL.com.
That's right.
Yeah,
I can hear,
wait, go back to what you said. Say it again.
Say it again.
I would prefer to do them earlier in the day, younger in my career, because I had to use so much brain energy to try to talk to people the way that they needed to be talked to. Now it's more natural, right? I don't have to actively think about what I'm trying to say and how I'm saying it.
Yeah.
That part of it is easier. But yeah, I mean, you need to be on your game. And I would tell you, the biggest thing you can do is don't have a bunch of stuff scheduled next to a new patient. Don't do it. Not if you're trying to give them your all and you're trying to give them the best experience you can give them. Utilize your auxiliaries, absolutely. I mean, you don't have to be standing there while they're getting a full mouth series taken. I mean, that's absurd. But yeah, I mean, you want to devote that time so the person feels you connecting.
Yeah. I love this. I want to be respectful because I'm not kidding. I have like 15 more questions and we've already been an hour. So we'll call this part one. Give us some final thoughts. Wrap this in a bow. Charlie, you went first. So Chris, I want you to go first on like wrap this up for us if I'm a listener.
Sure. In the new patient process, your admin team is where it begins. They need to understand core purpose. They need to answer the phone with a smile. They need to start building connection and recording the connection, meaning in their chart note, on things that have been discussed. I think that is exceptionally valuable. So when you have the patient in for a new patient conversation that is in a non-clinical area, you can tie back to those things and they know that information is being transferred, and that builds trust. I would challenge everyone out there to learn more behavioral concepts. I think that can really help elevate you not only professionally, but personally. And we're not just talking about the relationships with our patients. We're talking about the relationships with our family, friends, and staff. I would tell everybody, if you're going to speak dogmatic, you need to continue to go learn.
Love it. Charlie, wrap this up for us.
I'm going to go back to what you just said, because it really has been sort of my mantra in these last 5 years, where I kind of figured out who I was going to be. And that's, I can be confident in what I'm doing. I can be excellent in my dentistry and still have a whole lot to learn, right? Like, I am curious. I want to be curious. my only fear of dying is that that's where I have to stop learning, right? There's just so much out there that I want to see and do and experience, and we have a finite amount of time to do it in. So, like, give me something else, right? I want to find something else. I don't want to get stuck in a rut anywhere, doing a procedure I don't want to do, or in a system that I can't adapt. Like any of those things, there's always something new for us to learn. So that's been really helpful. And then, find people that are, some are like-minded and some aren't like-minded, right? Like I have Chris. So you brought it up earlier, Kirk, like, just about processes. Like Chris will call me, and be like, get your pen and paper out. I got a bunch of ideas. So he'll just, throw a bunch of ideas out, and I will write these down. And then my job is to figure out how to make these things reality. And that's why this partnership that we have works so well. That's why we teach well together. We're not identical, right? I don't think that would be very fun. We wouldn't learn anything from each other if we were doing the exact same things. But I'm certainly not a driver. But I can organize thoughts, and come up with something that's tangible. So find those people and cultivate those types of relationships. You may have them on your team, right? Like Chris said, he's the driver. He's not working with 30 other drivers. You have to know those people and how to experience them in the best possible way, so that they're elevating their experience, as well.
Yeah, so well said. We have a lot of listeners here. I always want them to do something. If I'm listening to this podcast, tell me what to do next. Give me some homework. You mentioned the Pankey Institute. You mentioned some of the courses you guys are doing. Tell them where to go if they want to learn more about this.
Yeah, go to pankey.org. Most of their registrations now that are happening online. Pankey.org has that listing of courses. Chris and I, like we said, are doing a brand new Mastering Treatment Planning course. It is really about bringing cases down, and we're all going to work through cases together. I'm not expecting you to have answers. We're just going to try to create a process that everyone can go home and work on together. Photography, we have a great course down there for that. I'm teaching the Mastering Aesthetic Restorative Dentistry, which is my baby. I love that course so much. So lots of great options down there in the essentials and outside of the essentials courses. But like Chris said, look at those leadership books. So, what are people that are experts in their field? What are they reading and what are they doing? Start taking that step to figure out, who do you want to be when you grow up?
Love it. Chris, give us some actions. Tell us what to do here.
I would give the action of really making sure that you yourself are healthy. I think that's a thing that we don't talk about very much is personal health, whether it's mental, physical, diet, exercise, giving yourself space to go for walks. Like you got to carve out time in your day, in your life to better yourself internally. From a didactic standpoint, I think the Pankey Institute is an exceptional place to start with the essentials. You do learn a lot of these things that we're talking about, and then you get to evolve into other things that are more complex, and you can then utilize based on a foundation. Everything in dentistry is foundational. That's the way the dental school is built. That's the way that you should evolve as a clinician as well. I really like Adam Grant as a writer. I think his stuff is gold. When you read it, it makes so much sense. If you're a natural leader or not a natural leader, it can help you just build frameworks as a coach for your staff, because that's really what you want to be, is you want to help push them to have them grow in an environment that is built for that. And it's the same thing for your patients, right? All of our patients have so much potential for health, and that's our job, is to help facilitate it.
Yeah. So well said. Gentlemen, I am so grateful for this time. And we're going to do this again and again and again. You like that? I didn't even give you an option to say no. So stick around while I say goodbye to everybody else. But thank you guys for listening to the Best Practices Show. This is the stuff I love. You know, I love watching new great leaders bring great value, some great frameworks, great thoughts to help you improve your practice and your life. And I'm going to have these guys back again and again and again. If you're not taking notes during the podcast, don't worry. Here's how this works. We're taking notes for you. So whether you listen to Stitcher, iTunes, Spotify, flip up to the notes, you're going to see links to everything they mentioned during the podcast. Click on them. It's going to take you right there. Check it out. I promise you, you won't be disappointed. So keep sending us suggestions. We'll keep lining them up. We'll keep bringing it. So until we see you guys next time, or you hear from us next time, keep watching, keep listening to the Best Practices Show. You guys enjoy your day.